I'm Erica Natividad on Hospital Row in downtown Toronto, which in recent days has been the scene of anti-vaccine protests. Massive groups of people gathering, speaking out against healthcare workers. Similar protests have been happening at hospitals across the country, and now major medical organizations are coming together to say enough is enough. In Toronto, Winnipeg, Edmonton, and Vancouver, throngs of people outside of major hospitals holding signs and shouting within view of the doctors and nurses inside.
The people inside of those hospitals have been working around the clock now for over 18 months, caring for a huge number of patients on top of the normal demands of their work. And they carry on into this fourth wave, caring for people critically ill who are largely unvaccinated. So I think it's incredibly demoralizing for all the healthcare professionals inside of hospitals to then look outside and see people protesting against them. Heartbreaking, really.
The Canadian Medical Association and Ontario Medical Association say over the past few days, healthcare workers have been subjected to bullying, harassment, and even violence by those opposed to vaccines. In some cases, demonstrations have blocked emergency vehicles and even made it difficult for some cancer patients to get to and from chemotherapy appointments.
This type of behavior is entirely unacceptable and unbecoming and very un-Canadian.
This week, Ontario announced proof of vaccination would soon be required to access some non-essential services, joining BC, Manitoba, and Quebec in introducing a vaccine certificate program. But doctors say those upset about these policies have misdirected their anger.
They should be protesting at political locations, not at hospitals where people are receiving care. And those same people who are out there protesting are going to be going to those same hospitals to seek care if they themselves or their loved ones become sick.
And this morning, Liberal leader Justin Trudeau addressing the abuse and pledging to do more to support frontline healthcare workers.
They're surrounded and being protested and being harassed and hassled and blocked by anti-vaxxers who are harassing them at the hospitals in BC and Ontario and right across the country. As leaders, we need to do everything we can.
The CMA says one of the most effective ways to combat this behavior is to address the misinformation driving these protests.
This uptick in misinformation, it's really scary for me because I feel for the people who are believing it. You know, there's obviously a small group of people who propagate this misinformation, and the people that pay the price are the people who believe it.
Widespread burnout among healthcare professionals has caused many to leave the workforce during the pandemic. Smart says she worries that this kind of harassment could be the last straw for many more. In Toronto, Erica Natividad, City News.